I am Dr. Ryan Murray. I am an orthopedic surgeon specializing in pediatric orthopedics and sports medicine here at MedStar Georgetown University Hospital. The patients I see typically are very diverse. They range from small babies and children up into adulthood. My primary focus is on orthopedic sports medicine conditions, but I also see patients with fractures as well as other orthopedic issues related to childhood. My philosophy of care really centers around shared decision-making with patients and their families, getting to know the patients and what their goals are, and then explaining the way I'd like to approach their treatment so we can arrive at a conclusion that results in the best possible outcome for the patient. Orthopedics is a really rewarding field. We get to see patients of all different ages and activity levels and goals in life, and we are able to, in a short period of time, prescribe some type of treatment, whether it's operative or non-operative treatment, to get patients back to the activities they enjoy, and that makes it a really gratifying specialty in medicine. The future of sports medicine, particularly pediatric sports medicine, is really exciting. There are a lot of innovations happening, not only in technology, but also in terms of research, where we can really apply the best techniques and practices that we use in adults, including high-level athletes, to younger patients while considering the unique anatomic and age-related changes in pediatric patients. The best part about this job is coming into the clinic and seeing patients who I previously met when they were not so happy and they'd recently been injured or they had a setback in their rehab, and then they come back and they have overcome that and they can say, I'm really happy because I'm able to do this activity or was able to play in this game, and that makes all the difficult times worth it. When you come here to MedStar Georgetown, everyone has a soft spot for the pediatric patients, and they really go out of their way to make sure the experience is a positive one, and I personally work really hard to make sure that my patients get the best possible care so they can get back to the things they want to do. Pediatric orthopedic surgeon takes care of kids of all ages, from the small children and babies all the way up through the adolescent growth period and into adulthood. So we approach orthopedics in a similar way to adult orthopedists, but we have younger patients that have certain considerations related to their growth. Orthopedics has a lot of different subspecialty areas, and pediatric orthopedics is one of these subspecialties that deals with the growing and developing child and the treatment of orthopedic or musculoskeletal conditions in that population of people, which is slightly different than adult patients because children are still growing and the treatments need to consider and respect the growing skeleton. Among the most common conditions that people come to a pediatric orthopedist for include limb alignment abnormalities, particularly bow legs or knock knees, and oftentimes these are normal variations of growth. However, because they're so obvious to the families, they oftentimes bring them for treatment. Other things that commonly present to a pediatric orthopedic surgeon are fractures ranging from a small buccal fracture to a displaced or angulated fracture, all of which require varying degrees of intervention or care. And then as children get older, particularly into their early adolescence and teenage years, oftentimes injuries are related to sports or recreational activities that require some treatment in order to get them back to those activities. Many orthopedic conditions are the same in children and adults. The things to consider are the unique anatomic variations of kids, which include their growth plate, that each bone has one or two growth plates at either end, and oftentimes those are the weakest parts of the bone, if you will, because they are still developing and they're cartilage based. So a lot of times injuries exist around the growth plate, which doesn't exist in adults. But many of the same principles and treatment considerations apply among adults and pediatric patients. The unique aspect of pediatric orthopedics is considering how these injuries and the treatment will affect growth. I think the biggest indicator that someone should seek medical treatment, especially from a pediatric orthopedist, is when their child's not acting themselves. Parents know their kids better than any doctor ever would. And oftentimes parents say, I noticed that he wasn't, climbing the things he likes to climb or running, as fast as he used to. And I think that's the time when you feel like your child's not doing the things they used to do, that you should seek attention and treatment from a pediatric orthopedic surgeon. Children have growth plates as part of their long bones, and as they get older, the bones grow longitudinally or lengthwise from both ends of the bone, and those growth plates are responsible for transforming cartilage cells into bone cells that then increase the length of the bone. These growth plates are typically active in children until about 14 years old in females and 16 years old in males, at which point children are mostly skeletally mature at that time. So the interesting thing about taking care of children is that every child's a little bit different and everything exists on a spectrum. And so children, when they're first born, their legs are actually kind of bow-legged, but no one really pays attention to that. And as they start to walk, they walk a little funny with a waddle, and people then may take note that one child's legs are more bow than the other. Interestingly, as children get older, they actually, in the preschool age, start to have some knock knees, and this is just natural physiologic variation. And then some kids are more knock-kneed than others, and this oftentimes raises some concern, especially when kids are close in age but not, exactly the same age, because they can have different appearances of their lower extremities, and this can be really concerning to parents, particularly when maybe they didn't have that with their other child or with their child's peers. So a lot of orthopedics, particularly sports medicine, is the treatment of overuse injuries. And in pediatric orthopedics, the unique thing about overuse injuries is oftentimes they occur in the same places as adults, but for a different reason. And that's because tendons insert on kids' bones via a growth plate, and that's called an apophysis. And that essentially is a growth plate that grows under tension. And when that growth plate is pulled on a lot by a muscle or tendon that's being overused, you can get inflammation of that growth plate, and it can be slightly more sensitive than perhaps the same injury in an adult. And the important thing is that this doesn't necessarily affect the growth of that area of the bone, but it does need to be treated, typically with rest and rehabilitation, before aggravating or that injury again. Pediatric fractures and adult fractures all occur by the same mechanisms. However, pediatric fractures are different in essentially two ways, one of which is we're very fortunate pediatric fractures that a lot of them can be treated without surgery. And the reason for that is in part because they are growing children, and so even if a bone is not exactly aligned the way it should be in adulthood, as a child grows, their body has an amazing ability to remodel the bone back to a normal shape. So there's a lot more tolerance for the way a fracture is lined up, and then that allows us to treat these non-surgically in the vast majority of cases. The other factor that is unique to children is the presence of a growth plate. Fractures around a growth plate occur in part because that is the weakest area of the bone. So if a child lands on their wrist and they have a fracture of their wrist that involves the growth plate, that is because that area of the wrist is sort of the weakest part, and it doesn't exist in adults. And so there are certain considerations in treating a growth plate injury that are unique to kids because adults don't have a growth plate. Pediatric fractures require operative treatment for a couple of different reasons. The most obvious one would be if a fracture is open or the bone is exposed to the outside world. That requires surgical treatment. The other reasons for surgical treatment of pediatric fractures are those which cannot be held in place with a cast or some other type of immobilization device. Those may require operative treatment, or fractures that have been attempted to treat non-operatively in a cast that have displaced outside an acceptable window of variation in measurement. Those fractures are best treated with some type of operation in order to get them to heal in the best possible position. So there's this notion in medicine that children are not just small adults, and that is in fact true when it comes to pediatric orthopedics. However, I think in treating pediatric sports medicine injuries, you kind of have to have both viewpoints in that pediatric athlete is very similar to a high-level professional or college athlete, that all they want to do is go back and play their sport. And so you have to approach them with the respect of what they want to do, the same way you would as someone who does that as part of their career. However, you do have to sometimes give them a little bit of a reality check and remind them that as a young athlete, there will be plenty more time to play sports, and so they have to slow themselves down. And in many ways, treating pediatric sports-related injuries is as much about managing their expectations as it is about managing their injury. And so in treating kids, you kind of have to get to their level and realize that for this young person, the next weekend's game is the most important game in the world to them. And my job as the doctor is to treat them in such a way that they realize that maybe this game was important, but the subsequent ones will also be important. And we have to get them back out there for all of them. Pediatric ACL injuries are among the most common things I see, and there's a growing number of ACL injuries among adolescents and young children, related probably to the abundance of opportunities for sports year-round. The thing in treating an ACL injury is I'm always asked whether or not they need to have ACL surgery. And oftentimes I do recommend ACL surgery after discussing the reasons for that, which include persistent knee instability if someone does not have their ACL operated on. And that can result in cartilage or meniscus injuries later on. However, specific to the ACL surgery, when you approach a pediatric patient, there are certain things to consider. Traditional adult-style ACL reconstruction goes through the growth plate and violates it. So in younger children, we have to take certain considerations about the growth plate and how we treat the ACL injury, whether that's using an alternative technique or simply being in a position where we monitor their growth after surgery to be able to detect any abnormalities as a result of an operation. Cartilage injuries in pediatric patients can occur for a number of different reasons. The most common I see are osteochondritis dissecans, particularly of the knee and occasionally the elbow. And these are conditions where the bone underneath the cartilage can become detached or inflamed related to repetitive injury. And oftentimes I see these patients and they either have long-standing mild knee pain or elbow pain, or they have an acute or relatively sudden injury where their knee gets very swollen and aggravated. And in these different cases, there's things to consider as to when you treat these patients without surgery or with surgery, particularly in children that are still growing and have open growth plates. They have a tremendous capacity to heal these problems non-operatively, whereas those that are older, more skeletally mature, oftentimes we need to consider other treatment options. Patella instability, or the kneecap sliding out of place, is commonly seen, particularly in adolescents and young adults, and it oftentimes is related to either a sports-related injury, or in folks with risk factors for this, they can have it rather insidiously with everyday life. And when we see these patients, they typically have a swollen and painful knee, and they don't really want anyone to touch or move it. And the question then is, how do you figure out, number one, that they had this dislocation of their kneecap, and then how do you treat it? And oftentimes the initial evaluation involves x-rays and then potentially an MRI scan or advanced imaging. But fortunately, the treatment for a first-time dislocation of the kneecap oftentimes is with physical therapy and non-surgical treatment. And only when they have difficulty returning to the activities after this treatment do we consider other options. Shoulder instability is common among young adults and adolescent patients, particularly those involved in sports activities. And when someone dislocates their shoulder one time, there are things to consider in terms of the likelihood a shoulder would be to dislocate again. Things to consider are the hand dominance of the patient, the sports they participate in, particularly contact and competitive sports, their general ligamentous laxity, or just the loose jointedness or lack thereof of a patient, as well as other things related to their first dislocation, including the amount of bone injury at the time of their initial dislocation. Return to play in sports medicine is oftentimes one of the most challenging things to decide, because patients are typically feeling pretty good well before we let them go back to sport. And so there's a period of their rehabilitation recovery from either non-surgical or surgical treatment where they want to go back and we're basically not letting them. And the reason for that is oftentimes because even though a patient feels good and they've recovered from their injury, they've lost some of that edge, and that makes them better, whether it's muscle mass or some agility or some element of their game that they need to gradually get back into before they go back out and risk repeat injury. So I oftentimes tell patients, particularly patients who have had surgery, that there's going to be a period of time late in their rehab where they think, I don't know what I'm doing, because they're going to say, well, I feel fine, I should go play. But we know from research and experience that patients that go back too soon risk repeat injury or a different injury that can set them back further. I think parents and families should bring their children to MedStar Georgetown for their pediatric orthopedic care, because not only is this a leading academic center with cutting-edge research and technology, but also we have a great team of subspecialists in all the different areas of orthopedics, whether it's hand surgery or foot and ankle surgery or spine surgery. So although they may meet me for the first time, I have many colleagues that I can interact with and share cases with, and really get the patient the best care that they deserve from an orthopedic department that is well-rounded in all subspecialty areas.